Alrighty, so now we are discussing the shortage or the bad need for recruiting in the United States of America, and this presentation is copyrighted by Diamond Medical Recruiting. So Diamond Medical Recruiting is an international recruiting company in the healthcare sector, and in today's presentation I will show you by numbers that the service of the DMR, Diamond Medical Recruiting, is badly needed and will continue to be needed for decades to come. Here are some numbers. The workforce crisis numbers. For instance, the global staff shortage, about 11 million healthcare workers projected by 2030 by the whole organization. That means in 2030, there will be a bad need of 11 million people to work in the healthcare sector. And when it comes to physician, the shortage in the physicians is 86,000 projected in 2036 by the AAMC surveys done last year. When it comes to the hospital needs, the hospital are facing elevated turnover. For instance, the RN turnover is 16 to 18%. That means for every 100 nurse that gets a job this year, 16 to 18 of them will be leaving their job next year. So there is a huge turnover for the RN, and that means that these positions for the RN, 16 to 18%, will need to be filled, and will need to be filled immediately. And that's where the recruiting comes very handy. If you take a look at the next slide, the access gap across the United States of America, the primary care healthcare professionals shortage area, HPSAs. Here are some examples. 77 million people will be suffering due to the shortage of the primary care health professionals. And so what is the HPSA? It's basically three categories. The primary care physicians or nurse practitioners, and that includes internal medicine, family practice. Some companies consider OBGYN also to be primary, and general practitioners. The criteria includes populations to providers ratios, which is really escalating so drastically. The other area of the primary care is the dental health, where every patient needs to go to the dentist office. There's a huge shortage in generating dentists and dental hygienists. And the same thing looks for dentist to population ratio is frightening, increasing. The worst problem is in the mental health, which is also considered to be a primary care. And that includes the license, all of the psychotherapists in the area, including LCSW, LMSW, etc. There's a huge shortage. And as you can see, nowadays, there is the psychotherapy is badly needed. Almost everyone has some sort of psychological disorder, whether minor depression or anxiety or slightly bipolar or schizophrenia, etc. Due to the massive bombardment of the social media and other circumstances that we live in. So that really escalates the need for the mental health social workers as well. Let's take an example. For instance, what is to remove the designation, 13,000 additional primary care clinicians would be needed. Primary care clinicians, that means primary care doctors and nurse practitioners and physician assistants, 13,000 of them. When it comes to the mental health and dental HPSAs, compound access barriers, it's really a huge problem that we are facing in the United States of America. And there's no immediate remedy for it. And that's where the recruiting companies such as Diamond Medical Recruiting is badly needed. And if you continue on the RN level, there is 48% of the hospitals across the United States of America report a 10% vacancy. So that means if the hospital has, let's say, 200 nurses, they have 20 of them are vacant. 10% vacant, that means they need to be filled. Where to get them? The hospitals cannot get them directly. They have to go to a specialist like us, recruiting company that knows where to find the best qualified nurses and check their credentialing, past experience, personality-wise, background check, license checking, etc. If you take a look at the next survey, full-time vary by specialty. For instance, 59 to 100 days for RN in 2024. That means the RN are not really working as hard as they can. And the reason is because they are in big demand. Hospitals are afraid to fire them or to terminate them. Why? Because they cannot really find a replacement. It's very hard for them. When it comes to aging of workforce, sizable share planning to retire within 5 years. So in the past, the retiring age was 59 or 59 and a half. Now that retiring age is extending. Many workers continue to work beyond that age. Why? Because there is a big shortage to be filled. If you take a look at the median time to fill, for instance, for a physician, to fill one position, the range is 120 to 135 days for many specialties. That means that that position of a dermatology, endocrinology, internal medicine, primary care, family medicine, whatever, any specialty, it takes 125 to 130 days in average to fill that position. It's a very long time. That means almost 1/3 of the year, the patients will not have a provider to see them in that center.
Yeah, I know this from when I worked at KU Med. Like, it takes so long to get through the HR process and all the things. Like, it literally took months and months. So, yeah, no, I can see that. And then, so then it shouldn't. And I just remember when we were working, like, even in my role, which isn't like a high paying role, sterile processing, which is like surgery tech and stuff like that. The travelers would get hired into working really quick. Well, so
100%. I was trying to get an appointment with a specialist a few weeks ago, like a dermatologist or things like that. And the earliest that I can get is 3 months ahead. 3 months ahead. Why? Because there is a huge shortage. So some appointments I was trying to get for myself, it was 6 months ahead. 6 months ahead.
Yeah, even my son needs like a braces evaluation, and he's on the list for January.
Here you go. So we're in August. This is really a joke.
Yeah.
There's a huge shortage of providers. Some specialties exceed 160 days, like OBGYN. We had to recruit for a client in New Jersey. And it took us a very long time to find the suitable ones. There's not many OBGYN providers.
Yeah.
So the app rolls still requires 80 days. So it's not a simple thing to do. And that's why we come very handy. We are the experts. We have the expertise. We really have a lot of tools and the strong arm to reach out to these providers. So the lost revenue also is a very big factor. Lost revenue for the unfilled physicians, 7,000 to 9,000 per day. So the company is losing, the urgent care center or the primary care center is losing 7,000 to 9,000 per day if they don't have the physician. So when you come very handy as a Diamond Medical Recruiting, reach out to the medical director or the HR director to replace or to fill the position, they will be gracefully giving you 3, 4, 5 days worth of loss to get them the right fit. You see, that's where we come very handy.
Yeah.
So 6 months GI vacancy. Look at this, $1.4 million lost in revenue if they have a GI vacancy. Unbelievable. Recruiting a physician costs about 180,000 to 250,000. What is hard to find the perfect fit, and that's where we come very handy. There is a competitive marketing. There is recruiters juggling 60-day open role on average. mismatch between the credentialing culture and communication expectations. And that's where the diamond comes very handy. In the past, when I personally owned multiple healthcare centers, I was dealing on the other side with the recruiters. So I was basically the client or the employer. The recruiters that I dealt with, they would do only one job. They will submit to me the resume or the CV of a candidate, and that's it. I have to do all of the background check, the personality check, whether they will fit the company or not. Also verifications of the education, the CME, many things. In Diamond Medical Recruiting, we do all of that. We may get like an amazing candidate on paper with 4 board certifications and all kinds of required licenses and CMEs, etc. But we also check the personality to see if that person or that candidate indeed fits 2 things: the culture within the employer organization and the leadership style. Nobody does that except us. We in the Diamond Medical Recruiting, we extensively look into the personality of the person, whether he is introvert or extrovert, whether he's a team player or not a team player, whether he or she has great communication skills, whether they are timid, whether they are open, whether they are honest, expressive. All of these features of personality dimensions, we look into them. And for selected candidates for critical jobs, we also have them run through the Achiever. The Achiever is a personality dimension assessment tool that we use, and we derive them from the LMI, Leadership Management International. No other recruiting company in the nation use that tool. It's basically a survey that the candidate have to take over the internet. We provide the username and password, and they will spend about 20 to 30 minutes answering questions. At the end, when they click submit, the report is generated, which is very expressive of the true personality of the candidate. We have attestation from 28 United States government that says that the Achiever is a true reflection of the person's or the people's personality. It's an unbelievable tool. And Diamond Medical Recruiting is the only company in the nation that uses that tool. It's called the Achiever. So we pay a lot of attention to the candidates. Again, not only their credentialing, board certifications, licensing, degrees, diplomas, all of that good stuff, but in addition to that, their personality.
Now, I did have a question because I've just been looking up,
Sure.
researching different things. Like, we're interviewing people, we're, having them take assessments, we're checking the backgrounds and stuff as well. And then, like, are we offering, like, what kind of, do we offer any perks or benefits or just the pay?
Right. So, no, are you talking about the package we offer to the candidates?
Yeah.
Yeah. So for the candidates, we negotiate. We don't let the employer or the client negotiate. We personally negotiate with the candidate the employment package. If they are part-time, then we offer them the hourly rate. So that there's only one number to negotiate because they don't get benefits.
Yeah.
So we negotiate the hourly rate between the client and the candidate. But if the candidate is intended for a full-time position, then we negotiate with them, with that candidate, the salary or the hourly, the benefits that includes the health insurance, the PTO, 401k, and sometimes also the type of work, like how many days per week will they be on site and how many days per week they will be remote, that kind of thing. So there's the employment package includes 4 elements: the salary, the health insurance coverage, the 401k, and the PTOs. But in addition to that, there are some customization that we do, such as the hybrid style of the work.
And then also, like, do we offer, well, I guess that's more for like temporary workers than permanent workers, but like housing benefits or anything like that?
Yeah, so that comes very seldom, which is like, for instance, some employers offer housing, but we've never dealt with any employer that offers housing yet. But there are some special circumstances, which is like moving expenses, sign-up bonus, traveling expenses, some perks such as reimbursement for meals or clothes or things like that. But these are really very rare to have.
Gotcha. Cool. I've just been researching about that stuff. So yeah.
Yeah. We sometimes we offer also the employer, which is our client, additional service such as background check. And we contracted with the nationwide top background check companies. They check the criminal record, the license record, the sexual harassment or assault records, and many other records. And by doing that, we produce these reports and then we submit it to the clients.
Gotcha.
Yep. Yeah. So we are international recruiting company, and that really matters. We expand our talent pools ethically amid domestic shortfalls, stabilize staffing and ruler understanding, and also requires diagnosis screening for training, languages, culture, fit, etc. So DMR differentiate ourselves, which means what are our competitive edge? We are a global sourcing company, US compliance expertise, license, visas, etc. In addition to behavioral and soft skills assessment tied to roles, success factors and criteria. And we spoke about that extensively in the last slide. Mm-hmm. Also, the right fit matching across credentialing, personality, and communication. So we consider all of these factors into the fitting. Sometimes we reject a lot of candidates despite the fact that they look really great on paper because their personality, we think, does not fit the culture of that organization or does not fit the leadership style of the organization. The DMR fit engine methodology, what we do, how do we fit it? So we do the profile the role, clinical scope, population, surveyed work area, KPIs, etc. KPI is key performance indicators. We also do the triangular candidate fit, credentialing, validity, traits, communication style, etc. We also do the structured interviews, scenarios-based simulations, reference analytics. Every candidate that we get, Peter, has to go through 3 interviews before we feel comfortable submitting them to the client. The first interview will be with the senior recruiter. The second interview is with the manager of the recruiting team. And the third interview is normally with me, which I am the CEO of the company. When I get a candidate that already passed the first 2, then I know for sure that the credentialing, licensing, NPI, certificates, board certification, etc. are all clean and nice. I check the last piece, which is the personality fitting within the organization. So my role is really to check the last one, the fitting the personality within the organization. So when I feel comfortable about the candidate, then that means that the candidate has passed the 3 points of check, and then we comfortably submit the candidates to the client.
Gotcha.
The outcome clients can expect: reduce time to fill via pre-vetted global pipelines. I did mention 3 steps of interviewing before. So when the candidate reaches the client, the employer, 99.9% they will accept that candidate. And so far in the last, I would say, year or so, we never got any rejection from the client. Every single candidate that we submitted got accepted by the client.
Awesome.
So why do we spend a lot of time filtering and vetting the candidates? Because that's where the quality of Diamond comes into handy. We are claiming that we will be saving the clients, which is a healthcare center or organization, tons of time and effort by submitting the fully fitted candidate to their organization. So that will save them the time and make them focus more on what matters most, which is the healthcare quality to their patients. And that's why our clients love us. No exceptions. We also improve patients' access and revenue capture by closing the vacancy faster. I showed you earlier how much is the loss for every single physician loss per day, 7,000 to 9,000 per day. 7 to 9,000 the organization is losing for not hiring the right candidate. So when we come handy into the picture and bring the right candidate, then it becomes no-brainer for the client to hire them. Also, we built the workforce for the entire organization. So we set the priority needs and reviews based on the locations, the shift pattern, etc. DMR, rapid intake, 72 hours, candidate slate for common specialties, and we contact us if they have any need for additional roles. Do you have any questions about this presentation, Peter?
No, I don't have. The presentation's pretty clear. I guess I'm just